ਅੱਜ ਦੇ ਸੈਗਮੈਂਟ ਵਿੱਚ ਅਸੀਂ ਤੁਹਾਡੀ ਮੁਲਾਕਾਤ ਕਰਾਵਾਂਗੇ ਐਲਨ ਗਲੈਸਰ ਨਾਲ, ਇੱਕ ਫਾਰਮਾਸਿਸਟ ਹਨ ਅਤੇ ਇਹ ਸਾਨੂੰ ਜਾਣਕਾਰੀ ਦੇਣਗੇ ਅਸਥਮਾ ਬਾਰੇ। ਅੱਜ ਅਸਥਮਾ ਦੀ ਬਿਮਾਰੀ ਬਹੁਤ ਫੈਲ ਰਹੀ ਹੈ। ਕੀ ਕੁਝ ਕੀਤਾ ਜਾ ਸਕਦਾ ਇਸ ਨੂੰ ਰੋਕਣ ਵਾਸਤੇ? ਜੇਕਰ ਕਿਸੇ ਨੂੰ ਹੈ ਤੇ ਕਿਹੜੀਆਂ ਦਵਾਈਆਂ ਦਾ ਤੇ ਕਿਹੜੇ ਨਾਨ ਪ੍ਰੈਸਕ੍ਰਿਪਟਿਵ ਡਰੱਗਸ ਦਾ ਫਾਇਦਾ ਲਿਆ ਜਾ ਸਕਦਾ ਹੈ? ਆਓ ਜਾਣਕਾਰੀ ਲੈਣੇ ਆ ਐਲਨ ਗਲੈਸਰ ਤੋਂ। ਵੈਲਕਮ ਟੂ ਦ ਪ੍ਰੋਗਰਾਮ।
Thank you, Harpreet.
Thank you. So today we would like to know about asthma and emphysema. What are these things and why does this happen?
Okay, so asthma is a situation where people, you've seen them or you feel it yourself, you're very wheezy, you have difficulty breathing, you usually make a noise.
Right.
Okay, that can happen, in small children and into adults. It doesn't matter. And we do have usually inhalers as a way to control it, and a couple other devices here.
Right.
So basically, in an asthma situation, normally we have bronchial tubes.
Right.
Right, which you can see is nice and clear. It's pink. It's healthy.
Right.
When you have asthma
Yeah.
and you can't breathe and your body is making a noise, then everything is red, swollen, inflamed.
Okay.
You see the tube is blocked off.
Right.
The muscle that used to be relaxed here is contracted.
Tense. Okay.
And we'll call this crud. It's got a fancy name, but
Okay.
anyways, there's crud in there that you can't breathe out,
Okay.
and you're choking and coughing. We have drugs that treat that.
Right.
One's in a blue vial, it's called Ventolin or salbutamol, and then we have drugs that prevent it.
Okay.
In terms of why it happens,
Yeah.
People can be exposed to things in the air. We have mold, you got pollen, you got dust. It can be something as simple as that. Other people with asthma, which will clog up their bronchial tubes,
Right.
can be something as simple as exercise-induced asthma, where you exercise,
Right.
and just the fact you exercise irritates the lining of your lungs, and they end up you can't breathe.
Okay.
So it's really important to treat this. It is a totally treatable disease. It's
Right.
totally preventable from you having to go to hospital to treat it if you've got the right tools, and you've seen your doctor,
Right.
and you follow the regime.
So, Alan, basically, what does research show? Or this chronic inflammatory disease, lung diseases, which happens, are there any particular reasons for this? Is it the environment or your eating habits that lead to all this?
You know what? Sometimes, yes, it's the environment. I mentioned pollution.
Right.
Right? Just mold that can be in homes. We can get pollens that can trigger it.
Right.
The other thing that can trigger it is they found that eating gluten. This
Okay.
is people who may be slightly sensitive to gluten. That's in the form of wheat.
Okay.
So any form of wheat that contains gluten might even trigger
Oh.
this asthma. So it is sometimes things you eat and things we breathe in.
Okay.
So those are things you can start attempting to avoid to see what's triggering an asthma attack.
Right. And a person who is having this attack at that time, what drugs can be used?
Okay. The number one drug comes in a blue inhaler. I didn't bring those.
Okay.
Anyone who knows, it's a blue inhaler. The drug name is salbutamol, or the brand is Ventolin. That is your emergency drug.
Right.
Now the key is, if you're a person who's having to use that blue inhaler more than twice a week, you have very poor control of your asthma.
Okay.
The goal is to give you better control. And so really in asthma, this is what's happening.
Right.
Remember, everything's swollen and inflamed. This muscle here
Right.
is very tight. So your blue inhaler, all it does is relax this muscle. So we have a nice clean
Right.
airway. The goal is to have a wide airway.
Okay.
And that blue inhaler relaxes the muscle.
Okay.
We have other kind of drugs. They're called steroids. Not the stuff you inject. But anyways, these are called corticosteroids.
Okay.
They reduce the swelling. They stop the body producing phlegm inside the lungs so that
Okay.
you can breathe easier. So we have two ways to treat it. One is to treat the symptoms immediately with the blue inhaler.
Right.
And the other one is to treat the symptoms using corticosteroids. And there's
Okay.
corticosteroid inhalers, as well as if in severe asthmatics, you take a prednisone pill, which is
Okay.
called a cortisone steroid.
So you're having this tube in your, which you have brought. What is this?
Okay, so when you have a inhaler
Right.
that sprays out a spray,
Yeah.
if you just stick it in your mouth, you only receive 10% of the drug.
Okay.
If you can get this spray into this chamber,
Right.
called an aero chamber, this one's a respiratory chamber.
Right.
You put your inhaler in this end, you
Right.
squirt it, It's then suspended in this tube,
Oh, and it goes directly inside.
but then you can breathe it in
Okay.
and you don't lose it to the air.
Okay.
If you spray it outside,
Right.
it goes all over the room.
Right.
You spray it in this chamber, the drug is contained here.
Right.
Now you get 100% of the drug in your lungs.
Okay.
And they go to work,
Right.
stopping it just like that.
So you also have these small inhalers kind of things. And
That's right. Well, this is a different way.
Right.
Most of us have seen these aerosol and sprays. Here's the other one. It's called a discus, and basically you put your mouth on here and inhale. It's a
Okay.
very fine powder. If you want to save the environment, don't have anything spraying into it,
Right.
you just inhale this, and
Okay.
it's real easy. And the other advantage of this, it's got a counter,
Right. You can just close
and it
also.
tells it if you got 0 to 60 here.
Okay.
Tells you how many puffs you have, because when you have an inhaler,
You don't know.
sometimes you don't know.
Right.
Okay? This is for another device, and it works similarly. You put a capsule in here, you cover this, it crushes the capsule into a
Right.
powder, and you inhale it.
Okay.
Okay? And it's for another drug called Spiriva.
Different technology.
Little different technology.
In case you don't have the drugs, and is there any alternative at that time?
Yes. The most interesting thing is if you're near a coffee shop or a Starbucks, you need caffeine. Now, caffeine will act a little bit like that blue inhaler, the salbutamol, and it will act to relax the bronchial tube so that this part of your body, which is really tight, will relax and open the airway if you drink very strong tea,
Okay.
any kind of black tea
Right.
that's really strong, or a triple espresso.
Okay.
So caffeine in a big dose
Will help you out.
will help your breathing. So
Okay.
if you're wheezing and whatever and you've run out of your drug, there's a simple drug like
Solution,
caffeine.
just take that.
That's right.
Okay, now of course you always come and tell us about the side effects. So definitely for the drugs which you are taking here also, they must be having some side effects. What kind of side effects are there, and what's the treatment for that?
Okay, so the number one drug, when you use your rescue medication, more than 8 puffs in one day,
Okay.
it acts like adrenaline. That's
Oh.
the salbutamol. It's a blue canister, salbutamol or Ventolin. It starts to make you have a very rapid heartbeat,
Right.
nervous, and sweaty. That's not good, because rapid heartbeat means your blood pressure is going up, the stress on your body is going up. We don't want that. When you're taking these corticosteroids, the ones that reduce the swelling
Yeah.
and reduce the the redness and irritation in your lungs, when you have too much of that,
Right.
it can actually suppress the body's own production of corticosteroids, and then you have a problem, because you don't want to suppress that. You're subject to more colds and flus and
Right.
everything else. So it does affect your immune system when you're taking. That's the two simple things.
Thank you very much for this information.
Well, thank you for asking.
ਥੈਂਕ ਯੂ ਸੋ ਅੱਜ ਜੋ ਅਸੀਂ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਐਸਥਮਾ ਤੋਂ ਜਿਹੜੇ ਲੋਕ ਸਫਰ ਕਰ ਰਹੇ ਨੇ ਉਸ ਪ੍ਰਤੀ ਇਹਨਾਂ ਨੇ ਦੱਸਿਆ ਕਿ ਕਿਹੜੀ ਕਿਹੜੀ ਚੀਜ਼ਾਂ ਅਵੇਲੇਬਲ ਨੇ। ਇਨਹੇਲਰ ਦੀ ਇਹਨਾਂ ਨੇ ਗੱਲ ਕੀਤੀ, ਇਹ ਟਿਊਬ ਦੇ ਵਿੱਚ ਪਾ ਕੇ ਜਿਹੜਾ ਇਨਹੇਲਰ ਹੈ ਇਸ ਨੂੰ ਮੂੰਹ 'ਚ ਪਾਇਆ ਜਾਏ ਤਾਂ ਕਿ ਇਹਨਾਂ ਦਾ ਕਹਿਣਾ ਕਿ ਸਾਰੀ ਦੀ ਸਾਰੀ ਜਿਹੜੀ ਦਵਾਈ ਹੈ ਪਫ ਜਿਹੜਾ ਹੈ ਤੁਹਾਡੇ ਸਰੀਰ ਦੇ ਅੰਦਰ ਜਾਏ ਜਿੱਥੇ ਲੋੜ ਹੈ। ਉਸ ਤੋਂ ਇਲਾਵਾ ਛੋਟੇ ਇਨਹੇਲਰਸ ਦੀ ਇਹਨਾਂ ਨੇ ਗੱਲਬਾਤ ਕੀਤੀ ਹੈ ਤੇ ਨਾਲ ਹੀ ਖਾਸ ਤੌਰ ਉੱਤੇ ਜਦੋਂ ਕੋਈ ਡਰੱਗ ਅਵੇਲੇਬਲ ਨਹੀਂ ਹੈ, ਕਿਸੇ ਕਾਰਨ ਤੁਸੀਂ ਇਹ ਭੁੱਲ ਗਏ ਹੋ ਘਰ ਵਿੱਚ ਜਾਂ ਤੁਹਾਡੇ ਕੋਲ ਤੁਹਾਨੂੰ ਅਟੈਕ ਐਸਥਮਾ ਦਾ ਹੋ ਗਿਆ, ਤਾਂ ਉਸ ਸਮੇਂ कॉफ़ी शॉप पे जाके फटाफट कॉफ़ी पियो इन्होंने कहा, क्योंकि कैफीन जो है ये बहुत मदद करती है जिहड़ा ये इन्फ्लेमेशन हुई है उसनूं घटाउण दे विच। काली चाह पी लो या फिर कैफीन पी लो, यानी कि कॉफ़ी लै लो, तो उस नाल तुहानूं बेनीफिट मिल सकता है। जिहड़े साइड इफेक्ट्स की इन्होंने गलबात की है उहदे बाद मुतलक इन्होंने दस्सिया है कि ये चीज़ां दे साइड इफेक्ट्स तो होंदे ने, लेकिन उस समय जो ये राहत मिलती है तुहानूं वो जरूरी है, वो जरूर तुसीं प्रिस्क्रिप्शन जिहड़ी भी तुहानूं दित्ती गई है उस दे मुताबिक तुसीं काम करिया करो।